So you have high levels of triglycerides in your blood. Having triglyceride elevations can be the result of many health conditions like obesity, diabetes, or renal problems. But what does this mean? What does it mean to have this high component in the blood? Can you be cured naturally? In today's video, I want to talk about how you can lower your triglyceride levels naturally before it's too late. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel, as a conventional doctor, I treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to receive notifications and be the first one to watch a new video. If you need an online appointment or quality supplements for your disease, visit drlandivar.com, and I encourage you to stay till the end of this video, where I will share extra tips and video links related to this topic. So what are triglycerides? Triglycerides are an important measure of heart health, for one, and they're the most common type of fat metabolized in the body. And they can either be consumed or be produced by the body. So what are triglycerides? Triglycerides are an important measure of heart health, for one, and they're the most common type of fat metabolized by our organisms. They can either be consumed or they can be produced by the body. Triglycerides normally circulate in the bloodstream to supply energy to almost every cell, and if not used up, they're stored as fat for future use. But if there's excessive levels of triglycerides in the blood when stored as fat, this elevates the risk for obesity and heart health, and can also be indicative of certain health conditions like type 2 diabetes, hypothyroidism, or even kidney disease. So today I want to talk about how you can lower your triglyceride levels naturally before it's too late. Before we start, I'd like to mention what normal triglyceride levels are. And this is very important because extremely high levels over 1,000 can cause serious health conditions like pancreatitis that can even become fatal. You should aim to have triglyceride levels below 150, and anything above 200 is considered a high concentration. Okay, so let's dive right into the treatment. I'm going to try to make this video as concise as possible, dividing it into two parts. In each segment, I'm going to refer to the treatment of each cause. So it's important to consider them all because each segment is a complement of the next. Part 1, the risk factors. Number 1, being overweight. It's no surprise that being overweight can be a very important risk factor for high triglyceride levels. If we think about this for a moment, triglycerides are one of the most accessible sources of energy that the body has. But if they're high, then the body will use some of it and save the rest for later. The problem with this, of saving fat though, is that it only makes us gain weight, reducing our chances of being healthy. So my recommendation with this aspect of the treatment is, if you're overweight, lose some pounds. Number 2, a sedentary lifestyle. Having a sedentary lifestyle is another very important risk factor for high triglyceride levels. And again, the same rule applies here. Triglycerides are the source of energy, and if you're consuming foods that are high on a calorie index, the body necessarily needs to burn all that fuel. If this doesn't happen, well then triglycerides levels go up and it's hard to control. So get some exercise. And if you have a job that requires you to have a sedentary lifestyle, like sitting down in front of a computer all day, well, give yourself short breaks and move around. Use that energy and make your body have some activity. Number 3, alcohol. Incredibly enough, even small amounts of alcohol can have big spikes in triglyceride levels, and this is obviously no surprise. Let's not forget that alcohol is quickly transformed by the liver into sugar or energy, and the body can use this as a source. So what I suggest you do is limit your alcohol intake as much as possible. Number 4, hypothyroidism. Hypothyroidism is also a very common risk factor for triglyceride levels in the body. You see, your thyroid controls how much energy or activity each cell in the body has to have. It has an impact over the energy of every single tissue in the body, from the first hair on your head to the last nail on your toes. So if you have low thyroid functions or low T3 or T4 hormones, then you'll obviously stop burning energy as well as you should. Hypothyroidism can be, for example, will make you gain weight, lose hair, or even be constipated. So if you have high triglyceride levels, hypothyroidism is always something you should be considering. Something I always recommend my patients to do is take a seaweed of any sort that contains high levels of iodine, like, for example, kelp or bladderwrack. Try taking a pill a day to keep the doctor away. Number 5, diseases. Other risk factors that are very important to consider with high triglycerides are, for example, diseases. So diabetes, high blood pressure, these are all very important. The best thing you can do in this case is that you need to treat your condition, treat the cause. Only then will you be able to lower those triglyceride and cholesterol levels. Right after this video, check out these other videos on the subject. Part 2, the natural treatment. Number 1, foods you should eat. There are many foods that have proven to be very valuable when treating triglyceride levels. I suggest you incorporate these foods into your diet for maximum effect. Olive oil. A food that's accessible to everyone is olive oil. This oil is loaded with unsaturated fats, and extra virgin olive oil has been shown to lower triglyceride levels and enhance heart health. Vegetables. Vegetables are a top nutrient-dense food, meaning they're high in vitamins, minerals, and fiber, but very low in calories. Nuts. Nuts are rich in fiber and healthy fats. A review of 25 studies showed that eating more healthy nuts was associated with lower levels of total cholesterol and triglycerides. Seeds. Seeds are another one, and seeds have proven to be lower triglyceride levels. Includes, flax seeds, pumpkin seeds, and they both help keep your heart healthy as well. Salmon is another one. Fatty fish like salmon are packed with beneficial omega-3 fatty acids, which can help you decrease triglycerides, cholesterol levels, and even relieve inflammation. As a matter of fact, omega-3 fish oil has proven to be almost as effective in lowering triglyceride levels as medications. Turmeric. Thanks to the presence of a powerful compound called curcumin inside turmeric, turmeric shows a great ability in lowering triglyceride levels in the blood. Garlic. Garlic is well known for lowering blood pressure, and research shows also that it can be very beneficial to lower cholesterol levels in the blood. According to a review of 39 studies, consuming garlic regularly for at least 2 months can lower your cholesterol levels and reduce your risk of heart disease. Number 2, foods you should avoid. Let's not forget how important food consumption is. Everything we eat has to be absorbed and converted by our intestines or our liver, and has a great impact on what runs on our blood. So if you have a diet imbalance, you'll not be able to balance out triglyceride levels. So clean up your diet. And this is a quick review of the foods you should be avoiding at all costs. Sugars and refined carbohydrates. Consuming too much sugar and refined carbohydrates is the worst way to treat this condition. Remove these foods immediately. Try to lower the intake of sugars and carbohydrates, and you're going to see how much this helps. Alcohol is another one. Now, drinking a glass of red wine per day, not other types of alcohol, can actually be beneficial for the heart. So consume alcohol in moderation by sticking to 1 serving per day and not more. Trans fats. Trans fats are found in processed foods and prepackaged baked goods. Trans fat can increase your triglycerides, your cholesterol, and even increase the risk of coronary heart disease. The best thing you can do is cut down on healthy fats by minimizing the intake of processed foods. And I stress this part of the treatment, okay? Remove unhealthy foods. Number 3, supplements. This is one of my favorite parts of the video because supplements do a great job in lowering triglycerides, and some of these even do a better job than conventional medications. So let's start off with fish oil. Fish oil can be extremely beneficial, and it's very effective as increasing levels of HDL cholesterol, which is the good cholesterol, while lowering triglycerides and LDL cholesterol. You can take about 1 to 2 grams daily. Lipoic acid is another one. Researchers found that lipoic acid supplementation can actually increase the rate of disappearance in triglycerides in the bloodstream after eating it. In a 2009 study published in the Archives of Biochemistry and Physics, researchers found that lipoic acid-treated rats greatly lowered triglyceride levels. Niacin. Niacin also comes as vitamin B3. It's commonly used in the treatment of high triglycerides or cholesterol, and in fact, niacin reduces triglycerides and increases beneficial HDL cholesterol. You can take about 1 gram a day. Now, if you have any liver problems, I discourage you from taking niacin because it can actually cause liver toxicity for those people. And garlic. Garlic is great for people who suffer from hypertension, for example, and high cholesterol levels. Aged garlic extract actually is in particular has been shown to have cholesterol-lowering properties and triglyceride-lowering properties in both human and animal studies. Help out the channel by giving this video a thumbs up and sharing it with your friends and family. And if you have any questions or comments, feel free to leave them down below and I'll be happy to assist you. If you need a quality supplement for your disease or an appointment, visit drlandivar.com. And right over here, I suggest you check out these other videos related to this topic. You will find valuable information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.